Uterine microbiome testing has been coming up constantly in my clinic lately, especially for women navigating recurrent implantation failure, unexplained infertility, or repeat pregnancy loss. So today, I want to walk you through what this testing actually is, why it matters, and who might benefit from it. So to start, let's talk about what we're really looking at here, right? The uterine microbiome refers to the community of bacteria living inside the uterus. And just like the gut microbiome, it can have a profound impact on inflammation. Now, for most of medical history, the uterus was assumed to be sterile. It wasn't until the last decade, with advances in next-generation sequencing, that we even discovered the uterus actually has its own low-biomass microbiome, a very small but very meaningful community of bacteria. And it matters for implantation and for fertility outcomes. Now, understanding that shift has been key because once researchers began mapping the uterine microbiome, something really important stood out. Research over the last decade, including a recent fertility and sterility review, shows that the bacterial community inside the uterus can influence inflammation, immunity, and implantation potential. One of the most referenced studies by Moreno and colleagues in 2016 found that women with a Lactobacillus-dominant endometrium had a dramatically higher implantation and live birth rate compared to those with a dysbiotic dominant microbiome. In that study, live birth rates were close to 59% in the Lactobacillus-dominant cases versus roughly the 6 to 7% for the other bacteria dominating. So the next question becomes, when is this type of testing actually helpful? Well, in clinical practice, I find uterine microbiome testing most helpful when a patient has experienced repeat implantation failure, recurrent miscarriages without a clear cause, a history of chronic endometritis, or biopsy findings that show inflammation or irregular patterns. Now, this is not something most people need to do early on in their fertility journey, but it becomes increasingly important when other core factors have been ruled out and outcomes aren't matching expectations, and especially in situations where the embryo is genetically normal, but implantation keeps failing. The two most commonly used tests are the EMA and ALICE tests, sometimes combined in one panel. So EMA analyzes the composition of bacteria and whether lactobacillus is dominant. ALICE looks for pathogens associated with chronic endometritis. Now, these are generally done alongside an ERA, but they can also be ordered independently. Something I always walk my patients through is the actual process, because it's not a blood test, and often people are surprised by that. To properly analyze your uterine microbiome, your doctor needs a sample directly from the uterus. So that means it's done via a uterine biopsy or during a mock transfer cycle. A thin catheter is passed into the uterus to collect tissue, which is then sent for genetic sequencing. It's quick, though some people might feel some brief cramping, and you're usually asked to avoid intercourse for a few days beforehand. Once the lab processes your sample, the results are usually very straightforward. You'll see percentages of different bacteria, especially lactobacillus. So your results will either classify your microbiome as lactobacillus dominant or not, or microbiome dysbiosis with identified pathogens. Now, based on those findings, your doctor might recommend antibiotics, targeted probiotics, a repeat biopsy, or adjusting timing or strategy for your embryo transfer. Now, I've seen this testing be incredibly clarifying for patients who've been through multiple IVF cycles or pregnancy losses without answers. This is not a first-line test, but when implantation keeps failing, especially with normal embryos, it can really be a game changer. So I hope this gives you a clearer understanding of uterine microbiome testing and when it can be helpful. If this was useful, please feel free to share it with someone who might benefit, or let me know if you'd like a deeper dive into related topics. And of course, you can subscribe for more evidence-based integrative fertility support.